disease analysis, which is kind of related. Those are more biomedical stuff. This is smart healthcare stuff, okay, where we are more interested in how to build the Internet of Medical Things, how to build the healthcare cyber-physical system so that we have sustainable healthcare. And particularly what right now my group is doing, how to have sustainable pharmaceutical supply chain. Okay, so anyway, so there are a lot of slides. I have hundreds of slides, but I don't know how much I'll cover. So please feel free to download and go through further. And I'm always very prompt in replying emails. Okay, so this is not just a 1 hour or 1.5 hour lecture, rather it's a beginning of something that if you want to carry forward as your research. I've roughly graduated maybe 4 or 5 PhD students in this area in last couple of years, and what I'm really proud to announce, all of them got excellent job offers and in fact direct faculty position without doing postdoc. Okay, so that's why that tells you this work has a lot of credibility, and have been funded by multiple federal agencies like National Science Foundation and NIDLR and so on this smart healthcare research. Okay, anyway, so like a lot of this is when we started, I remember roughly 8 years ago, we were kind of learning, okay, what is smart healthcare and so on. When a lot of people in various universities have joined and have started this area, and this area is really, particularly during COVID and this and those situations when people felt the need for smart healthcare, which in the previous generation, telemedicine and other things were used. So this has really broadened, and a lot of work has been going on. And if you see, take any e-commerce site like Amazon, eBay, or anywhere, you will see market is flooded with now smart healthcare devices, which was not the case roughly 10 years ago. So we'll know what is smart healthcare. We'll see what are the challenges. We will see specific. I come from computer science company background, what are the cybersecurity aspects. Then the drawbacks of what has been proposed. We'll have a little bit analysis of that. Then what my group is nurturing from the cybersecurity aspect is the security by design principle. We'll have some discussion of that. And as I just mentioning, trust to the pharmaceutical supply chain. That is important. And one student just recently graduated on this specific area. He's right now faculty in Central Missouri. And he also basically did some work on trust to the medical prescription. Okay, so these things we'll discuss. And as I said, there's a lot of material, and we will try to see how much we can cover, but please feel free to contact me afterwards. So what is smart healthcare? This is how a traditional system, and traditional system what I call as a one-to-many system. That means one patient who is having some issues is dealing with a variety of stakeholders. Okay, primary care physician, specialists, long-term care to pharmacy, all these different stakeholders, insurance at the end. Okay, all these are involved, and one needs to deal with them to get a healthcare. So that's the problem. Okay, how we kind of instead of one-to-many system, maybe we make many-to-many system or some other way, so that patient doesn't have to deal with so many stakeholders. That's the idea. Okay, so with that idea, people have been working. I won't say smart healthcare just came 10 years ago. Smart healthcare basically is now what you can say a system that evolved after a lot of different things. In fact, e-health, electronic health, that means the digitization of records to something that is more portable has been going on. Then telemedicine, I know, in fact, even from 20 years ago, telemedicine and other things used to be a big deal, and now post-pandemic that became really a mainstream thing, and that's now what you can say impact of that is now quite visible. And then the mobile health, that's a very interesting thing. What happened, whether mobile health came because we have smartphones, or mobile health basically integrated to a smartphone. Those are kind of debatable, which is a chicken egg problem. But that has evolved because like mobile phones have a lot of sensors, and people keep on adding a lot of stuff there. Then the connected health aspect I consider is a very important aspect, which is how the stakeholders are connecting with each other so that like a patient doesn't have to carry his or her records to each one of those and doesn't have to deal with those. So those are all the stakeholders are talking to each other seamlessly, and the patient is getting the healthcare service whatever supposed to be. So then the evolution of all these things integrated with various other things, particularly IoT came and more variety of connectivity is now available, okay, not just Wi-Fi, but other varieties including Bluetooth and other things are available. Then portability of devices, okay, that means wearables are more, implantables are more, and as a result, all these we have what is called smart healthcare. So next thing question can come to mind, why we do what we do? Unless we understand there is no point in doing research. So that's the slide that kind of gives some answer. We are doing because we want quality healthcare with minimal resource. Number of doctors, number of nurses is not increasing as proportional to the population. Particularly city population grows way faster. Okay, people migrate. Okay, it's not just necessarily when by birth or so on, people migrate. So that's a population growth is way significant, but with that respect, doctors, nurses are not available. So how we can improvise the capabilities of wearables like fitness tracker, then headband, all these examples we have, and then the connect various physical and stakeholders in the framework of what we call Internet of Medical Things, so that they can collectively provide quality service to the patient. So that's the big idea. And so I've done a lot of articles. I recommend to read the magazine articles that we have on this, and you'll find it quite interesting. And then from the computer science and engineering perspective, then when we want to build what is the overall big umbrella, big framework that kind of demonstrates that this is what is smart healthcare, this is what is Internet of Medical Thing, this is what is healthcare cyber physical system. So this we have drawn as illustration. In the receiving end, the left side is the individual patient, and the patient can have various sensors, various wearables, various implantable, and all these things. Then at the end, they need to connect. Let's say I'm at home, I want all the sensors, this and that, to be connected to my home gateway or something. So that is where we want to add intelligence to add to that. Then we can do that as AI and so on. And then at the next higher level, we have what we can call as the way local area network, that means information is going to the doctor, and also various various members of the family and so on. And then through internet, which wider network where a doctor is getting information of hundreds of patients that he or she is dealing with, and then cloud at the city level, at the state level, even at the national level. And in fact, during COVID, I was always thinking there is a possibility we can make international database for the COVID patient and so on, because every country is maintaining anyhow. So then we have way less hassle during air travel and so on to keep track of whom we have to keep track because of COVID and so on. So anyway, so that is the cloud, and much big AI can be done there. And then I always tell, let's not forget insurance providers. Insurance provider at the process have to process, at the end of the process, have to process the insurance claims, this and that. Then they have to deal with doctor, they have to deal with patient, and then they have to trust worthy the point of view. They have to verify that is a good faith claim, and have to process and process and speed of the process, all these things. And this is a big market. In fact, pre-COVID pandemic, smart healthcare market was 350 billion, which is now, I would say, much more, maybe $500 billion kind of basically market for smart healthcare. A lot of things can be done. In fact, very simple things, how to have a very good portable device, in even to let us say we have fitness tracker, it's still not measuring our body temperature correctly. We have fitness tracker, we have wearables, they are not doing glucose measurement. All these things are still unsolved problems. Okay, even very simple, I keep telling, even an accurate body temperature measurement through using a wearable is still a big deal. I don't see the devices doing that. So anyway, so a lot of market, a lot of potential, because whether it is cancer and other things are too big, we cannot even talk about. But at least daily glucose measurement, daily cholesterol measurement, all these things, and at least better quality of measurement for stress analysis. All these things can be done. Some, just the last few years, a lot of things have come, but a long way to go, particularly glucose and other point of view. Okay, anyway, so to do the smart healthcare that we are interested in, which is now a bigger umbrella, use of technology so that we get quality healthcare, and use of technology so that we have availability everywhere. All these things are needed. So what is that? That is basically kind of preventing, or that is kind of working in negatively in that aspect, and we do not have the what we are looking for. Many aspects are there. So and this is where first I go to a little bit bigger domain. At the end, a smart healthcare has to be made as a specific example or specific instance of Internet of Medical Things or cyber physical system. So the problems the cyber physical system IoT has